Hello everyone. In the previous section, I have discussed about the general feature of the clavicle bone, and in this section, I will discuss about the muscle attachment and the fibrous capsule which are attached and different ligament which are attached to the clavicle bone. Now, this is we know there are the two in, one is the lateral in and second is the medial in and the intervening cylindrical shaft. Now, the lateral in the margin of the articular surface, for its acromioclavicular joint gives attachment to the joint capsule. Now at the medial in, the margin of the articular surface for the sternum and gives attachment to the fibrous capsule of the sternoclavicular joint all around and the articular disc posterior superiorly and the interclavicular joint superiorly. Interclavicular ligament superiorly. Now the lateral one third of the shaft. The anterior border gives origin to deltoid muscles. Posterior border provides insertion to the trapezius and the conoid tubercle. This is the conoid tubercle and the trapezoid ridge gives attachment to the conoid and the trapezoid part of the coracoclavicular ligament. Conoid, tubercle and trapezoid ridge gives attachment to conoid and trapezoid part of coracoclavicular ligament. Thus, there are the interclavicular ligament, the coracoclavicular ligament, and the next is the medial two-third of the shaft. The medial two-third of the shaft, most of the anterior surface gives origin to pectoralis major, and half of the rough superior surface gives origin to the clavicular head of sternocleidomastoid muscle. An oval impression on the inferior surface at the medial in. Gives attachment to the costoclavicular ligament. Now, the subclavian groove on the inferior surface gives insertion to the subclavius muscles, and margin of the groove gives attachment to the fascia that is called the clavipectoral fascia. The subclavian vessels and cord of brachial plexus passes towards the adena lying between the inferior surface of the clavicle and the upper surface of the first rib. Now, the ossification. The clavicle is the first bone in the body to ossify except for its medial end. It ossifies in membrane. It ossifies from two primary center and one secondary center. Now some clinical anatomy which are associated with the clavicle. Clavicle is commonly fractured by falling on the outstretched hand. Most common site of fracture is the junction of the medial two-third and the lateral one-third, which is the weakest point. The lateral fragment is displaced downward as trapezius is unable to support the weight of the upper limb, which is the weakest point. The lateral fragment is displaced downward as trapezius is unable to support the weight of the upper limb. Next is the cleidocranial dysostosis. The clavicle may be congenitally absent or imperfectly developed in a disease called cleidocranial dysostosis. In this condition, the shoulder droop and can be approximated in front of the chest. That is cleidocranial dysostosis. The muscle attached. This is all about the muscle attachment of the and the different capsular attachment of the clavicular joint. And the main muscle attached to the clavicle, that is the originated from the clavicle, are the first is the pectoralis major muscle, second is the deltoid, only the anterior half of the deltoid, third is the sternocleidomastoid, sternohyoid, and fourth is the sternohyoid muscle. The muscle having insertion of the clavicle are the trapezius and the subclavius muscle in the subclavian group. The subtrapezius and the subclavius muscle are inserted on the clavicle. This is all about the muscle attachment and the different joint capsular attachment from the clavicle bone. Thank you.